you have a patient come in who's an elderly patient, has a history of COPD, and is presenting with gastrointestinal distress, some diffuse tremors, some hypotension, and tachyarrhythmia, really start thinking about theophylline toxicity. We use theophylline in the management of COPD and asthma because it causes bronchodilation and acts as a non-selective PDE inhibitor. The reason why toxicity can happen with theophylline is really because it has a very narrow therapeutic index. Naturally, in elderly patients, their hepatic clearance is decreased from baseline, and the hepatic clearance can be decreased even more if they're ill, such as having an acute infection, or if the patient has some type of cytochrome P450 inhibitor that they were administered before their visit. Some of the more common P450 inhibitors can be remembered with the mnemonic sickfaces.com. The S is sulfonamides, I is isoniazid, C is cimetidine, K is ketoconazole, F is fluconazole, A is alcohol, C is ciprofloxacin, E is erythromycin, S is sodium valproate, C is chloramphenicol, O is omeprazole, M is metronidazole, and lastly, although not part of the mnemonic, is grapefruit juice. When theophylline is used in excess, it works a lot like caffeine. It antagonizes the adenosine receptors, and you can have CNS symptoms like tremor, even seizures, cardiac symptoms like tachyarrhythmia, and also vomiting as GI toxicity. Because it's also a PDE inhibitor, this can cause peripheral vasodilation, so you can have hypotension in your patients. You can confirm the toxicity, of course, by getting a serum theophylline level, and you really want to do a supportive management for the patients like antiemetics, antiarrhythmetics, and also antiepileptics. In very severe cases, you may even consider hemodialysis. Try not to get too bottled down in a patient having arrhythmias because of this toxicity and ask to get an echo first. Remember, the patient has agitation, maybe even tremors or even vomiting, so it's better to treat supportively first. You may also be thinking maybe it's carcinoid syndrome, but remember, for carcinoid patients, you want to look for skin, GI, and lung problems such as flushing, diarrhea, or wheezing, respectively.